Hello.
My IT department. Oh
Uh,
gosh.
please tell us I said thank you.
Oh my gosh. I don't know what happened. My iPad froze. I tried to get you on my laptop. That didn't work. Let's see if I can get
Perfect.
you. There we go. At least it's better. Oh my gosh, I got totally.
I like how technology doesn't work on literally the busiest day to talk. Like I have so many questions for you from
Right?
a
I
lot of
know.
residents,
Okay,
and
okay, well,
so
let's do it.
I'll get
Let's do it. Let's get
we'll get
into it.
right into it. Okay,
Woo!
so obviously lots going on with the province today. So a lot of confusion too. So let me get you can't go out after 8 because of a stay-at-home order, right? But you
Well,
can
there's
go
not
out.
quite a curfew. There's not quite a curfew.
Okay. So explain
You
what is.
can walk your dog and you can go shopping until, well, you can go later than 8 because some of the grocery stores are open 24/7. It's the big box and the non-essential retail that has to close at 8. Now, we all got at the same time you did 2 hours ago. And so my call immediately following this one is with all our city staff and including our solicitor to go through all the regulations. But I have to
Okay.
say, but I have to say, I think it's the tone and the rhetoric that has changed the most. I mean, it was the tone of the stay home order and the new emergency orders, but not a lot more, not more substantive has changed other than gatherings of only 5 people rather than 10 people outdoors, and then the closing of big box at 8 p.m. And I'll share with you that we know there were some, I don't know, but there weren't capacity issues, but the lineups outside some of the big box today, as people heard the news, I guess they feared for early closures, so they all rushed to the big box store, and we had to send bylaw to ensure that they were enforcing the lineup, which wrapped right around the building.
Okay. So let's start from the top then. What does a stay-at-home order actually mean, starting this Thursday?
It means only go out for the essentials. Work from home, go out for groceries, for medicine, for recreation, for physical exercise, etc.
Okay. That sounds like a lot still, but but I mean, like, if it's for essential, and then you can go out to kind of do
No,
a. You there?
sorry, I'm here.
Okay. So,
It's just not my day for technology today at all. Sorry,
oh
keep
no.
going.
So, but yeah, so you have to be an essential worker to go out after 8, but yet you can still go out and pick up food curbside.
Not after, so hang on, there's no curfew. So you
Yeah.
can go out after 8.
Okay.
Then you can go out and walk your dog after
Okay.
8. You can go out and pick up groceries after 8. It's just the big boxes will be required to close at 8. And they're under capacity limits of 25%. But there are grocery stores that can stay open, and pharmacies, certainly, the Shoppers Drug Mart near me closes at 10 and some of them close at midnight. They can stay because they're essential.
Okay.
They can stay open longer. So you have to get away from there is no curfew being imposed. You can go out. You're encouraged not to go out, hence the stay-at-home order.
So the stay
And you may get questioned by someone as to why you are out.
so this stay-at-home order then, there will be more enforcement then after 8, correct?
Well, see, this is the problem because, again, it puts the onus on the cities for greater enforcement. So we are going to talk at 5 o'clock or shortly thereafter about what additional resources we may need for the enforcement of a stay-home order and what that will mean. And so we always have to wait until the regulations come out. And the regulations, of course, aren't out yet. So the announcement was today. They'll probably come out tomorrow because they're in place on the Thursday, right? So we don't know yet what the regulations will be. But for now, it's increased in enforcement and bylaw enforcement. And the Solicitor General, Minister Jones, Sylvia Jones, mentioned that they have 450 officers as well that the province does, but that sounds pretty spread, pretty thin.
Yeah, and
across the
that sounds.
province.
Yeah,
The
and that
onus is
sounds.
on the cities, right? The onus is on the cities.
So are you going on a kind of a bylaw officer hiring blitz? I mean, how does this work? I mean, when all of a sudden the province says, okay, it's the onus is on the city to enforce this, this new stay-at-home orders. Like, do you guys just hire just a bunch of bylaw officers? Like, how does that work?
So what has happened previously, and we've had this discussion as well, is we'd redeploy people from security or some of the people who have been temporarily laid off that had been working in our libraries or in our cultural facilities and our community centers, because those are all closed, right? So we've redeployed and retrained people to work in bylaw and enforcement.
Okay. Sick pay for essential workers wasn't.
Okay. I know, I was shocked it wasn't announced. It was shocked. And to me, that just tells me that I think they feel the onus is on the federal government to deliver the wage replacement or the sick pay. Now let's talk about a little bit, because I actually pulled up some facts so I could have some for you, because I was very disappointed. This is the one key gap I think right now that's missing to allow people to stay home with their sick and to have so the security that they will not lose their jobs and make more than what is currently available right now with the Canadian Recovery Sickness Benefit, which is $500, but $450 after taxes. And many of these people are earning more than that, and hence they only have a few symptoms or are asymptomatic, so want to go to work. And so that's the problem. We need a wage replacement. So we know that 42% of Canadian workers have access to paid sick leave. However, the difference is the number drops to 10% when you're looking at frontline workers and low wage income earners. Low wage and frontline workers, only 10% of them have paid sick leave. So that's where the gap is. And as I said, you can usually use it to a maximum of 2 weeks in 1 year. It's $450 after taxes. So if you go off for any other reason and then get COVID, you are in trouble again. So that's why we're saying this really needs to be wage replacement during the pandemic, and that really provincial governments need to provide up to 10 sick days during a pandemic like this. And I know that the Eileen Davila, the public health, doctor of public health in Toronto suggested that 5 is necessary in regular times, but 10 is necessarily during the pandemic. So the current benefit as well, the Canadian Recovery Sickness Benefit, doesn't give you any job security either. And we really need them to ensure that their jobs will be protected should they take this sick leave. And this is really the only way we're going to protect ourselves if people are symptomatic or have light symptoms or they have full out COVID. But at the same time, if it's those folks who are asymptomatic or only have, I just have a sniffle or a slight fever, I think I'll go to work because of course I need the money and I need to feed my family. People are making those choices, right? Because if they stay home, then they'll be, do I buy food, put food on the table, pay my rent? What do I do? So pay my family cell phone bill. So they have to make those choices. So there has to be greater wage replacement, and it has to come. Well, there is a program that delivers it federally. It has to be enhanced. And I think that's what the provincial government is doing. It's saying, well, it's a federal responsibility. And the federal government's looking at the province to deliver it, because they have delivered, of course, other fixed costs for hydro, rent, etc., property taxes they've provided for. So I think the federal government feels they could work in conjunction with the provincial government. So we have a little bit of this happening again, but this is essential. This is really vital to keep people at home when they're sick, ensure that they're going to get paid, and ensure they'll have a job at the end of it. The job security and the wage replacement.
I heard Dr. Lowe just recently, just a few minutes ago, say that it's essential for the Peel region to get sick pay to get the numbers down for COVID-19. So with what you saw with the province, what they delivered today in regards to the stay-at-home order, and everything else, is this enough to bring the numbers down in kind of like the GTHA?
It'll go a long way. So we know that 60% of the outbreaks have been in warehousing, manufacturing, food processing, and those are exactly the folks that are probably going to work because they don't have sick days or sick pay and want the job security. So in 60% of the outbreaks, we've had 235 active workplace outbreaks. So it's huge. It is, he is right, and this has made the difference in some European countries as well. I think Germany is a big one. So he and I agree. I think Mayor Brown does, Mayor Tory, all the GTHA mayors. We have passed motions. We have all advocated for this wage replacement, this sick pay benefit, and we think it is vital and it is necessary. Certainly, Peel Region passed the motion in December before we took the break at the holidays for the sick pay benefit.
Now, you say that this is mostly the Fed's responsibility. Is that correct?
Well, they're delivering EI right now. They deliver EI and they deliver the Canadian Recovery Sickness Benefit. So it can be an enhancement of that as well, right?
Okay. So it looks like now if
there have been, let me give you one more number, 8,700 Ontario workers have contracted COVID due to a work-related exposure.
What's the number, sorry?
8,700. 8,700.
Wow.
8,700, right? And there are 235 workplace outbreaks, and 60% of workplace outbreaks are in warehousing, manufacturing, food processing. But the important number really is that only 10% of low-income, low-wage workers have paid sick leave, right? That's the important one. 42% of Canadians do, but only 10% of the low-wage, low-income earners do, who are often the frontline people. Think of our PSWs in long-term care homes.
True. I guess now, if my math serves me correctly, February 11th is the day that Mississauga and Peel and Toronto and everywhere can get out of lockdown.
It was for 10th or 12th. It was a lockdown, and also the day where children can go back to school, right? Schools will be closed until then as well.
So let me ask you, do you honestly think that's realistic that the lockdown will be over on February 11th?
We need to turn things around. We got our new numbers in. Mississauga is now 200 cases per 100,000. That's a lot. Toronto was 211, but I expect they're a little higher, right? I haven't seen their number today, but they were 211 yesterday, but that was on the average for the previous week. On the average on this week, I bet they're 250 or closer to 300. Brampton's are 350 per 100,000. Okay. Brampton's positivity rate is 17%. There are cases in the flu clinics that their positivity rate's 40%. Our positivity rate is pretty high too. It's 10.5%. And the R factor, which is the reproductive factor, is 1.1. So it's spreading quickly. It's spreading quickly. Peel generally 260 cases per 100,000, and our average positivity is 13.7%. It's very high. It's very high. I remember when we were 4.5%. I remember when we were 5%.
I guess reading these numbers out, February 11th, what do you think? Do you think we'll get out of lockdown then, or?
I mean, we could if people took this very seriously. We've turned this ship around before. I mean, we had a reprieve in the summer, July, August, September. Things were better. You know, I remember 25 cases a day. I had a few days where I had 0 new cases. I was cheering. You know, now I'm having 200 cases a day on average.
Yeah, but it's there -2 right now, so it's good. I think we'll have more cases now. So, but I know we had a 10-minute hiccup there, so I'm going to get to the Instagram viewer questions here. Okay.
We should talk about the hospitals as well and the vaccines too, if you want to work those in, because that's some important information as well.
Well, I know that some of the Toronto hospitals have run out of vaccines. How's the situation in Mississauga?
So we do have a supply issue as well. The problem we have, quite frankly, is not enough people uptaking the vaccine. So there is a reluctance factor. So there are a number of essential workers. So certainly, let's say 6,000 people have received their vaccine at Trillium Health Partners. So that is frontline hospital workers. And in the community at our LTCs, that includes staff and residents of long-term care and seniors homes, only about 2,000. So we're still under 10,000 people. They are vaccinating between 75 people and 150 people a day, but they have the capacity to do, 1,500 to 2,000. So we have to get more people out to get the vaccine. Mind you, at that rate, we would run out of vaccine too. So there is a bit of resistance. So we do need more vaccine. We need fair share for Peel, and we need the same thing that Toronto has, which is the immunization center. They have the new immunization clinic, so all the essential workers can go to one place rather than either hospital or the other designated centers. And we need designated centers in hotspots like Malton, for example. Right, we need a designated center for vaccines right there. They're not going to come down to Credit Valley Hospital, by example, to get their vaccine, right?
True. My 100-year-old Lola got her first vaccine shot.
Oh, fantastic!
She's in a home, so she's doing good. Yeah,
that's great.
Yeah, so
that's very good news.
So let's get to a non-COVID question, if that's okay.
Okay.
All right. I know it's going to be weird. A Mississauga man launched a petition to save the outdoor skating rink at Burnham Thorpe.
I know, and that's a beautiful thing. It's a beautiful rink, and I keep telling him we are renovating and expanding the Burnham Thorpe Community Center, which is far overdue and needed as well, and that rink can exist close by. We're going to look for another site to move it. But if they don't want the enhanced renovated community center, we can keep the rink there. But I would think that the neighborhood would want the more, renovated community center. I mean, we've all heard him loud and clear. It's a great thing. It is a beautiful outdoor rink and it's covered. I get it. And it wouldn't close till after the season, obviously. But it's very important that that's one of our older community centers, that be updated and renovated and expanded. And we've never said that we couldn't reopen that rink somewhere close by, right? And we keep telling him that. And
So he just wants I think he just wants a nostalgic rink. But there can be another rink that is close by. Of course there can. Outdoor?
Of course.
Okay, all right. Hopefully he hears.
And I've been saying it. I said it to him on Twitter too. Councillor Fonseca's told him, our staff have told him, but.
Okay. So other questions here. This might not be your jurisdiction, but you might know the answer for this. Is Service Ontario closing in Mississauga during this kind of 28-day lockdown or stay-at-home order or whatever we call it?
Are they closed now? I'm not sure, but most of those services you can apply for online. If you have to get your health card or your driver's license renewed, your stickers, you can apply online. Okay.
Another one we have is, can we go out for a walk in our neighborhood with our household members?
Yes, they are now. Yes, you can go after 8. They've now got a restriction on 5 rather than 10 people. So this has to be sorted out. But I think that if you're the same household and you live together, then I think that would be fine. I mean, you live together anyway, so. Okay.
A lot of Square One questions. So pick one. Square One is currently doing pickup for non-essential. Does this change on Thursday? There's a lot of curbside pickup inside Square One. Does that change?
I think that's what ends at 8 p.m. along with the big box stores closing then. It's the grocery stores and the pharmacies that can stay open longer. But the non-essential retail, like the curbside pickup and the big box, must close at 8.
Okay. Will weddings and ceremonies be limited to 5 people? No.
It's a good question. So outdoors, it's 5. That didn't come up. I'll have to check the regs. I'll have to check the regs because he didn't announce that. Okay.
And a very serious question. Has Mississauga crime and mental health statistics been impacted by COVID-19?
The answer is yes. Certainly the mental health statistics, and we know increased incidence of, our concerns for domestic abuse, etc. I only know anecdotally. I don't have firm numbers, but I'm going to try and get some for you. Although the police have been out policing COVID, unfortunately. Yeah.
So another question, a question that I guess not from a viewer, from myself. Are police going to be actually enforcing this stay-at-home order? Are they going to be doing that? So,
that is another one of those questions we need to resolve. So certainly bylaw officers will. Whether we would use police for that, I would doubt it. I would doubt it. They are asked to follow up with travelers who have to quarantine, who were positive, that are not only required to quarantine, but are required to stay home because they're sick. So I know the police follow up on those people as well. But we do need them to protect our community and provide policing and community safety as well. So I would think that in most cases, for most things, it will be bylaw enforcement.
Okay, perfect. And there you go. It's 5 o'clock. I know you're crazy.
Sorry about that. I'm sorry about that. I guess I have to do some sort of update that'll update Instagram as well for my technology. Seemed to let me down today. I apologize.
Yeah. We got on, so thank you very much. I'll catch you next week.